a chiropractor. I've been practicing for 29 years, a lot longer than you've been alive. The beauty of coordinated health is we work together. We're all under one umbrella. Orthopedics, podiatry, PT here is fantastic. Chiropractic. We have a PA here who does the care on demand. And it's a team effort. Just like you have a team effort on the field, we have the same thing under one roof. Tonight Joe is going to speak about shoulder and knee injuries. He's going to give you a little anatomy lesson. He's going to keep it very basic. There will be no tests, no questions afterwards from Joe. And he's going to speak about, what we can do to help you. And I'll just go with a quick intro into chiropractic for some of you who've never had chiropractic treatment or do not know anything about it. So we're going to open up with Joe Conway. I'm going to operate the computer, so if there's any mistakes, it's my fault.
Again, welcome. Glad to have you here this evening. If you have any questions at any time, please don't hesitate to interrupt, and I want to keep it casual and informal. So please ask if you have any questions. To begin, I'd like to talk about shoulder impingement. Shoulder impingement, as you can see it defined there, is excessive pressure on the soft tissue structures of the shoulder. Bicep tendon, rotator cuff, which is particularly the supraspinatus muscle, and tendon, subacromial bursa, which is bursa underneath the acromion. It's a bone of the shoulder girdle. And also the undersurface of the acromioclavicular joint. That could be damaged and irritated as well, causing some spurring as we get older. Impingement leads to excessive wear and tear on those structures. And wear and tear, the first sign of wear and tear is there's pain. With pain, there could be decreased velocity, difficulty sleeping, difficulty reaching behind your back, difficulty reaching across your body, and certainly abnormal throwing motion. If you feel like your throwing motion is affected, could be having some signs of impingement. Go ahead. I want to talk a little bit more about the shoulder anatomy. I mentioned the rotator cuff tendon, and you can see that the supraspinatus muscle and tendon is right there. And you can see the proximity of that muscle and tendon to the acromion. If you have impingement, basically what happens is the head of the arm bone, when you're going through your arm motion, is rammed up under the arch of the acromioclavicular joint. And there's several things that can cause that impingement or that ramming of the humeral head up under the arch. You could have muscle imbalances. You could have joint capsular tightness. The entire shoulder joint is surrounded by joint capsule, and the rotator cuff tendons, which there are 4 rotator cuff muscles, blend into the capsule. If the capsule becomes stiff, the shoulder bone is not allowed to glide downward. So when you're lifting your arm, if you don't get a downward glide and that shoulder is not depressed as you go through the motion, it's going to pinch. And that's where you get pain. Pinching causes the pain. Any questions on that? Go ahead, Doc. Next slide. So we talked about some of the causes of shoulder impingement, capsular tightness, faulty mechanics, muscle imbalances. Faulty mechanics, it could be a hip problem that's causing you to throw awkwardly. It could be a leg problem. And in physical therapy and in chiropractic, we look at the whole chain. How is your body working when you're throwing? Some of the muscle imbalances that we see, the pectoral muscles are too tight, your chest muscles, so that creates a downward sloping of the acromion, creating some pinching. You can see tightness in the rotator cuff muscles, either toward the back, toward the front. And any of the larger muscles, you could see tightness in the latissimus muscle, deltoid. But a lot of what we see is the pectorals. You guys are student athletes, so the first part of that is student. So students spend a lot of time sitting. And as I'm looking at many of you, you're sitting with your shoulders forward. And with your shoulders forward, those muscles can tend to tighten up. So sometimes being the student causes the athlete to have some difficulty. Next slide. So I want to talk a little bit about treatment and prevention. We have orthopedic. Dr. Falvello is on staff here. He has many hours of office time during the week. He's also doing surgeries. But you know, if you have a serious problem, it's good to consult with an orthopedic physician. He's a valuable resource for medical management, injections, surgical consultation, and also clearing you to play. Are you okay to play or not? The surgeon gives great insight in that. Chiropractic care, as I mentioned earlier, some of the postural things can lead to spinal dysfunction, either of the neck or thoracic spine. And if you have dysfunction in your mid-back, that can create neck, shoulder, arm pain. And we feel that manipulation is another really important part to treating the shoulder. If you have shoulder pain, some restrictions in the rib cage or thoracic spine or cervical spine should be worked on. And then, of course, coming to see us in physical therapy, we focus in on the musculoskeletal system, the muscle imbalances that we spoke of before. We work a lot on flexibility as well and putting the whole kinetic chain together and making sure everything works properly. Next slide. Any questions? No? One of the key things to preventative maintenance is stretching and conditioning. You know, stretch the chest muscle, stretch the shoulder muscle, stretch the legs. Make sure everything is in tune and ready to go for the season. So your preseason conditioning is really crucial to your physical performance during the season. So I know the coaches emphasize that, but it is really important for you guys too. Next slide. Any questions? Next slide. Yeah, they're all websites. Do you want to jump in and jump ahead, and I'll finish up with me?
Yeah, maybe I will interject.
Okay.
Go right to the chiro.
Okay. The first click is the light.
Yeah, I'd like to bring someone up here, a little guest. You know, this is the perfect model of everything wrong. that somehow goes right, I guess, when she throws a ball. And without even getting into the chiropractic part and alluding on what Joe just said about, you know, the posture, the tight pec muscles, the shoulders rolling in. If you look at her from an aerial view, her shoulders are rotated inward. So she's got really tight pectoral muscles. She's putting an awful lot of stress on her scapular muscles. If we feel, you know, Joe talked about this joint. I can't remember the name, acromioclavicular or something. We call it the AC joint for short. She has a lovely AC joint on the right. She's it's very prominent, and you know there are some abnormalities that occur. There's several types of AC joints, types 1, 2, and 3, and that kind of talks about how they actually curve around and actually pinch down on the structures. You know, sometimes there's injuries to these that cause them to elevate, and sometimes they actually get a little arthritic early in age. So this young woman here is the perfect model of what not to be. But, you know, and like Joe said, take some lessons, you know, with the postural muscles. We need to straighten up a little bit, pull those shoulders back. You know, we like to have, if you turn sideways for us, we like to see the ear, the shoulder, and the hip in a line. And just looking from the left, I can see that her ear is well ahead of her shoulder. If you can see that, Joe, does it look that way to you? Yeah. So, you know, essentially what she's doing is she's also stretching her neck muscles all the time. And that reaches down to their thoracic spine. And when we get to the chiropractic part, we talk about manipulation. We want to actually free up these joints. We get some function back in here. There's dysfunction. The muscles pull on the bones. They misalign. They lock out of place. You lose mobility. You lose some mobility in the shoulder girdle. The shoulder girdle and the neck constantly interact. If somebody comes in with a shoulder pain, they're always going to have a neck issue. We always see it. Turn front ways again. Another thing, with impingement, when we raise up, she's doing better. She was pretty tight coming up. That seems to have freed up. But we see this commonly in people that throw baseballs. They get impinged. The structures are really tight. Joe is a master at loosening up shoulders and freeing up all that range. It makes a huge difference. Like you said, you'll get your velocity back. Your accuracy, I don't know. I heard some stories about your accuracy.
It's really good.
Yeah. But, working together on a patient, that's what we strive for. We strive to correct their posture, correct their muscle imbalances, try to get rid of their pain. Some of you with conditioning, as I'll talk about, you kind of come in, you're deconditioned, and you may not be ready for softball yet. And that's what your coaches do with the strength programs, the flexibility programs. So, make sure you listen to your coaches. They know what they're doing. They're there to help you. You consider, because I'm going to need you later. This is a fact. I didn't make this one up. 80% of the adult population suffers with back pain. That's at one time in their life. Okay. If you don't have it now, you're going to have it when you're 80. It's bound to happen. It's just, the fact that we spend so much time being sedentary. We don't exercise. We have poor posture. We have trauma. A lot of people that come in and see me, I'll say, when was the last time you exercised? Was it your last gym class in high school? And it was. So carry this through the rest of your life. Your coaches are probably teaching you great flexibility and strengthening exercises. Continue them forever. You want to stay strong. You want your body to function at a maximum forever so you don't end up here when you're 90, because Joe and I won't be here to treat you, and God knows who will be. The question I have, because a lot of people fear chiropractic, don't know much about it, but how many of you have undergone chiropractic treatment? That's pretty good. It's a little less than half. You hear, and Joe, yes, Joe. Joe's my personal chiropractor here. As we get into it, there's nothing to be afraid of. Chiropractic is very low risk. What people don't like is the popping sound, the gapping sound. But it's not, bones are not cracking, it's just joint spaces are opening. We're freeing up the joint. Sometimes we do actually kind of tear some adhesions that occur in the joint. They're called intra-articular adhesions, and they make a little sound, but that's all good. We free up the joint. It moves better, so it'll function better. Next slide, please. Deconditioning, out of shape. These are, that's one of the big reasons why athletes suffer pain. They come into softball. They didn't work out. We know it. You know it. The coaches know it. And, that's what this part of the program is right now. Just don't go into softball practice day one thinking you're gonna do everything and it's not gonna hurt, because it will. Aerobically, for at least 2 weeks before you even lift weights, you should do aerobic exercise to increase the capillary beds in your muscles so they're ready to accept the exertion and increased blood flow that you're going to bring to them. So you need to get into shape before you start softball practice. As far as lower back pain goes, or back pain in itself, post-exercise pain, it's called delayed onset muscle soreness. I'm sure some of you are having that right now because you came in deconditioned. You're using muscles that weren't used for a long period of time. That generally lasts, a day, 3 days. You put a little heat on it, it goes away. It's just a little lactic acid buildup. Once you get blood flow circulating and once you get into shape, that'll go away. Other things as far as what you need to do coming into the start of softball season, you need to have good core strength. A lack of core strength and muscle imbalance creates a lot of lower back pain. Joe and I see this all the time. Patients come in, they have no strength. They have no abdominal strength. They have no strength in their lower backs. I'm sure you've gone through a core exercise program, pelvic tilts, bridging, planks, abdominals. There's 33 muscles in the core, and it's something that you need to have strengthened because it acts as a support for your lower back. That's essential. Another reason, and big reason why you're going to suffer some back pain, especially in sports, is trauma. The strain, sprain injuries that occur, the collisions that you see at second base, usually at home plate. Falls, I'm sure some of you dive for balls in the outfield, shortstop, maybe the second baseman dives every now and then, every once in a while. You can obviously suffer injuries to your back, your neck. Repetitive motion causes back pain, neck pain, throwing, swinging. I looked at softball pitchers. I don't know how you throw a softball because it seems like you break all of a sudden, and there's just so much force on your muscles, on your joints. I don't know how you guys make it through the season. Those repetitive motions can definitely injure your paraspinal muscles, your joint capsules. So again, going back to the core strength, flexibility, addressing muscle imbalances, I think that's essential. Poor throwing technique is an issue, isn't it? Yeah. That's another thing that can cause some back problems. Again, the shoulder, the neck, the thoracic spine, they're all interrelated. Talk to your coaches if you're having a little discomfort. Let them look at your throwing technique to make sure you're doing the right thing. We can look at Doc Holliday, Phillies pitcher. I'm a Phillies fan. Retired Yankees fan, in case anybody's upset. But Holliday was having some mechanical problems, and they caused problems with his lower back. He said in the off season he did a lot of core, a lot of stretching. He's cleaned up his mechanics, so hopefully this year he goes 32-0 or whatever he's going to be. But these are definitely things that can all lead to pain in your back. One thing down here, if you have persistent pain, don't let it go. I've seen in high school athletes and college athletes, stress fractures occur. You're still growing. And there's a little area in your spine called the pars, and a lot of patients don't find out that they fractured their pars until they're older. It was once thought to be a non-union where the bones just didn't unite when you were younger, but now it's from microtrauma. It causes stress fractures, usually in your lower back at the 4th and 5th levels. So if you have persistent pain, get it looked at. Next slide. Why have chiropractic treatment? Well, as Joe said, we want to alleviate the excessive biomechanical stresses on your joints, your muscles. Occasionally we get patients that come in with pinched nerves. In your age group, not so much, more so in people my age. But, we can alleviate this with spinal manipulation and the other techniques we use. This is supposed to be traction. Modalities, ultrasound, stim, which I steal from PT. Use some massage techniques, trigger point techniques, and stretching. The overall goal of chiropractic treatment is to improve your joint dysfunction and alleviate your symptoms. Next slide. Your chiropractic visit, everybody comes in, they're a little nervous, don't know what to expect. They think I'm going to run up and do one of those MMA maneuvers. It's not like that. We take a history. We want to know if there's any trauma. We want to know about your pain. The evaluation, as we looked at our patient here, we look at them posturally, see what's going on there. Neurologically, check reflexes, check some strengths. There's some orthopedic tests that we can do, especially for shoulders. The chiropractic exam, it's pretty basic. It's like any other exam, same thing that the PTs do. We check the spinal ranges of motion, check shoulder, hip range of motion. The big thing that we do is palpation. It's a hands-on technique. So, we feel the spine to locate the areas of subluxation. And that's basically, the subluxation is a misalignment, okay? And when we can feel that the vertebrae is a little bit locked. We also use the term fixed. It's not moving properly. A lot of times it's accompanied by muscle tightness and tenderness. Been doing it 29 years. I can feel them in my sleep. It's once you do it, it's very simple. And Joe, being a PT who has great hands also, you can pick them out and say, hey, you need to see Dr. Palermo. Next slide. What is a manipulation or a spinal alignment? I was going to put the word generally in here. It's generally a non-painful manual procedure used to align the vertebral column. Very rarely will a patient have pain. It's usually if they have muscle spasm or if they have a lot of inflammation. They may feel a little pinch when we do it, but essentially it's like popping your knuckle. It doesn't hurt. The popping sound is simply a little nitrogen gas in the joint that releases. We call it an audible. Okay. Again, the bone is not cracking. It's just a little nitrogen gas, so don't be alarmed. What does manipulation do? It increases joint mobility, increases range of motion. A lot of times afterwards, we'll see patients will have better ranges overall in their neck and in their trunk. It decreases pain and pressure on the joint and the spinal nerve roots. During a manipulation, because we may take you into a stretched position, we actually can reduce some spasm by lengthening the muscle during the procedure. And this is a great ward, and I know Joe looks at this ward and says, wow, I can't believe Palermo came up with this one. But we steal everything from the PTs. Proprioception. Proprioception is, your brain knows where things are in space. If you close your eyes, you know your hand is up here. So the nerves in your joints actually have little fibers that tell you where you are. They're proprioceptive fibers. And that's one of the things that manipulation does. And some of the older patients will tell you if they have vertigo, if it's from their neck, we do an adjustment and they get their balance back. You have balance receptors in your joints in your spine. In fact, they're in all your joints. Ankles, Joe, big time. If you sprain your ankle, Joe is going to get you in here and he's going to do some really goofy things. He's going to have you throwing balls up on one foot. He's going to have you on the Bosu ball and the wobble board. All that is to restore proprioception. It's again letting you know where you're in space. It's all about your balance system. Next slide. How often do you need chiropractic treatment? I always hear, if I have an adjustment, do I have to have one like every month for the rest of my life? The answer to that, it's all about chiropractic philosophy. Again, we want to restore joint dysfunction. So it depends on how much stress is on your joint. If you're somebody who works in a factory, you're constantly lifting, you're on your feet, it's just physical 8 to 10 hours a day, we think periodic adjustments will help you function better. You know, I have patients come in every 4 weeks, every 6 weeks, every 8 weeks. Younger patients that don't have such physical jobs, you know, they may come in every 12 weeks just for an alignment. And again, it depends on the person, depends on what the situation is with their spine. Patients that have more degenerative changes obviously need a little more care. Acute conditions, they usually require several treatments per week until the symptoms and clinical findings improve. Most conditions that we see here, the strains, the sprains, even the pinched nerves, you know, 2 to 6 weeks. When you get around 6 weeks, if chiropractic treatment hasn't helped you, it's time to start thinking outside the box. You know, time to say, Joe, come in the room, look at this patient. What do you think? Dr. Falvello, you know, the orthopedist, I call him in the room. Our PA, Brad, you know, sometimes we need other things to help. Patients have a lot of inflammation. Maybe they need steroids, anti-inflammatories. But generally, in the acute condition, 2 to 6 weeks. Again, patients that like coming in and feel the benefits of chiropractic, they like to opt for what we call maintenance care, which is periodic treatment to maintain joint function. And they may come in 4 weeks, 6 weeks, 8 weeks, you know, every 3 months just for an alignment. Again, it's painless, improves your joint function. You know, again, if you stand up for me, dear. You know, if we look at this patient, now look, she's staying a little straighter now. She is your typical patient that comes in, athlete or non-athlete. They usually come in and we see the postural issues. On her first visit, I checked her neurologically, did her reflexes. I probably had her walk on her heels and toes. Maybe I did some strength testing in your upper extremity. But, we'll go through, we'll check her ranges of motion. As I recall, we had some issues in the cervical region. The shoulders, they were pretty nasty. In fact, I utilized the chairman of the board over here in PT and brought her out and had him look at her shoulders and show her some stretches because she had some real serious issues. And we didn't want that to lead into problems during the season, although I know we're a little problematic right now. We assessed her trunk range of motion, bent forward, and we had her come backward into extension. And I recall she was pretty good there. As far as the manipulation part, what we can do is let's put you on your belly first. So when we have a chiropractic patient in the office, palpation, feeling with your hands is everything. And I can feel when joints are locked. They have a fair amount of joint play, especially in a younger individual like Christy. So we'll go up the spine and feel for areas that are locked. And to me, that's a signal that there's misalignment, there's some dysfunction. Her muscles are a little tight, a little tender. So I'm not going to do it tonight, though. But prior to working on her, sometimes I may actually go and do some trigger point, may do some massage to loosen her up first. Use some heat. If she has a real, what we call hot trigger point, an active trigger point that's producing a lot of tenderness, may apply some thermal ultrasound, a nice warm ultrasound to kind of calm it down because she's had some chronic issues. The manipulation itself is pretty simple. Roll over onto your back. This is it's a generalized, she's already. This kid's a pro. This is a generalized manipulation procedure for the thoracic spine. I like to use this one because it's pretty easy on the patient. I always have to be a little more careful when it's an older patient because there is a little risk of a rib fracture, but I'm talking someone who's elderly, not a young individual like this. You have a good shot of this? Okay. So, essentially, I just place my hand under her spine, and do not do this at home. I went to school for this. She'll take a little breath in, she'll blow it out, and we just kind of lean down. I don't know if you heard that, but there was a nice little, there's a nice little release. Did anybody hear her scream? No. It's generally pain-free, correct? Yeah. You just feel a little release. And that's basically a spinal alignment, manipulation, adjustment, whatever you want to call it. But it's generally pretty smooth. It's painless. When she gets up, she's going to feel a little bit looser in that area because we've established more motion in there. It was actually fixed, locked out of place. So now she's got more motion in her joint. Very simple. I'll show you the lumbar spine manipulation. Is anybody up for the neck manipulation?
Me.
Okay. A lot of people are afraid of the cervical spine adjustment, and I understand why. I mean, it's close to your ears, so it's going to be a little bit louder. Somebody has their head in your hand. There's a spinal cord that traverses through your spinal column, but these are, in a younger individual, these are pretty easy. The key to this, we have a girl holding her hands over her ears. Okay, you don't have to look. Do you want to come up here and feel it? I'll put your hand here.
No.
All right. But the key to this is keeping the head up. We don't want to extend the neck, and we don't want to rotate at the same time. There's a 1 in maybe 6 to 10 million risk of stroke. There's 2 arteries that traverse through the cervical spine, the first 6 bones. They go to the base of the brain. So I like to stay away from upper neck adjustments because of that reason, because that's the most common area for that to occur. It's more common in females who smoke and are pregnant, or I'm sorry, on birth control. Reverse that one. But we're way down low. I'm actually kind of out of where her vessels are, and her head's up, and that's that. There's still a smile, and she still looks great. You can come on your side.
Which side? This one?
Yeah. So the lumbar spine adjustment, there's several ways to this, and not all chiropractors work the same. These are the manipulation techniques that I use. On some patients, we actually change them and use some gentler techniques. I think you like these techniques, right? Yeah. Okay. She said she loves them. But the lumbar spine technique is real simple. Again, I'm just going to do a little generalized maneuver. You kind of keep her shoulder back and just roll her forward. And just push through a little bit, and her joints open up. And, generally when we're done, the patient feels like they have more mobility, they have less pain. Again, if there are other issues, if there's muscle spasm, we can do things to alleviate the spasm with massage, or some trigger point therapy, some ultrasound, stim, heat. In the acute case, we would use ice, but it's pretty much painless. And if anybody wants to have an adjustment, just let me know. We definitely have to talk about the core, because how many games do you have in a season? 20? 40 games in a season. So, yeah, that's great. Your muscles are going to fatigue. We will. Your muscles will fatigue. You will get muscle imbalances. You will get, tightness, flexibility issues. So, I think you're in the right place. So, we'd like to help you out. My name is Michael Palermo. I practice at the Hazleton Coordinated Health Campus, and I'm a doctor of chiropractic. I always wanted to be in the health profession, and my dad injured his back and went to a chiropractor, and he just kind of steered me in this direction, so I went with it. I attended King's College in Wilkes-Barre. That's where I did my undergraduate, and then I attended Palmer College of Chiropractic in Davenport, Iowa. And I entered practice in 1984, and I've been practicing for 29 years. The biggest thing that a chiropractor does is spinal manipulation. So we work with the spinal column. We do have a good background in anatomy, physiology. The emphasis for us right now is treating the musculoskeletal system. I see a lot of acute low back pain, a lot of acute injuries from auto accidents, work-related incidents. Mostly it's musculoskeletal. We do see some neurologic conditions that come through the door as well. Lower back pain is by far the most common condition that I see. We base the treatment upon the patient's presentation and the findings from the examination. Some patients we will do manipulation, others may require traction, whereas some patients may just need modalities such as ultrasound, muscle stimulation, maybe some heat or ice, and some stretching. It really depends on what the patient presents with as to how we treat them. Unfortunately, most patients present to a chiropractor when they have an acute condition arise. From the chiropractic perspective, we like to see patients just come in when they don't have pain, and we actually will align their spine, preventing any issues from occurring in the future. I was on my own little island for almost 29 years, but now I have coordinated care. I have physical therapy available to me. I have orthopedists, a physician's assistant. So we have a coordination of care and that we can provide so many services. We have x-ray on site. So it's not only Mike Palermo as an individual, it's coordinated health. We're all involved in the patient's care, and it's a great system and it's working out great. What I want my Hazleton area patients to know is there is a difference with me being here. And the difference is I can offer more services to them. And I think I can do a better job than I've done almost the last 3 decades because of that. My lifestyle translates into my career as well, but I've been running for about 12 years. That's my biggest hobby. pretty much involved in sports, and yeah, I use the community a lot. We have a lot of nice running trails around here that I use, the Lehigh Gorge, the Hazleton rails to trails, and that's one of the nice things that the community does have to offer. There's a lot of open space. Yeah, I've grown to love the area, and the family's been very helpful, especially since day one. You know, they came in and brought other patients with them. You know, I've been doing this for a very long time. It's almost 3 decades, and to me, every day is just a new day. The thing I like about it, it's dynamic. I have new patients. I have older patients that come in with new conditions. So for me, it's just so dynamic. It never gets old.